So last in this set, query from Dubai, UAE. Can we base our prices on what the other dentists are charging? If yes, how can we know what they are charging? It's not possible to find about all clinics by calling. And yet they don't give clear answers. I just detailed this thing in the previous query. Are we really, or do we really need to bother about what colleagues are charging? Doesn't our charges should decide what exactly is? If those things are the deciding factor in this, shouldn't they be dependent upon your charges, your costing? Ask yourself. You should be worried about what your costing is and not what others are charging. End of debate. At the end of the day, you need to be profitable, not your neighbors. So worry about your costing, worry about your materials, worry about your calculations, worry about your net profit, worry about your gross profit margin, worry about your net profit margin. अगर किसी महीने आपको घाटा हो तो आपका नेबर आके आपको देके नहीं जाएगा पैसे. Remember that. Sometimes the patients don't ask for the price before doing the treatment. I am also hesitant to discuss the price beforehand, especially with long-time patients. Is it okay to tell the price to such patients after completing the treatment? No. You always need to tell them before so that they can make an informed choice. Probably they walked with an expectation of the treatment charges will be total 10,000 rupees. You gave them a budget of 20,000. It is falling beyond their budget. Another scenario, they walked with an expectation of 10,000 as a budget. You gave them a budget of 5,000. Puts a seed of doubt. काम अच्छा किया भी है कि नहीं, सब स्टैंडर्ड चीजें तो नहीं यूज करी, जरूरत से ज्यादा सस्ता तो नहीं है. Too much expensive, too much, you can say on the lower side. Both are bad. And what perception does the patient carry, even if it is an old patient? It is your duty to tell prior. That keyword is duty. That summarizes everything in this query. Should the doctor herself communicate with the patient, or it's better to have another number in the name of the clinic? It is ideally better to have a different clinic number. These days, the fashion of landline has gone out of, you can say, you can say possession of landline has gone out of fashion. So people keep cell numbers also different for clinic. Personal number should not be your. Of course, you may delegate it to a few close patients, few VIP patients, you may give it. But then they are the ones who are going to trouble you in the middle of a movie, in the middle of a travel, or middle of somewhere in the party where you are busy with those things. So choose your demons wisely. Everything will have pros and cons. Ideally, better to have a separate clinic number, be it a landline, be it a mobile phone. Is direct WhatsApp marketing a good option now rather than Facebook or Instagram? WhatsApp, Facebook और Instagram ने खरीद लिया है. And other than WhatsApp business APIs जो भी own करते हैं, जो उनके authorize नहीं है, उनको 10 मिनट लगते हैं नंबर ब्लॉक करने में. With no option, no सुनवाई, no बहस, nothing. Meta जिसको बोलते हैं, Meta means Facebook, Instagram और WhatsApp का जो Metaverse. It has one of the worst rules in social media today. Absolutely worse. YouTube, Google पे सुनवाई ज्यादा है comparatively. हालांकि वो भी बदनाम है, but Meta has the worst. And telling you from those personal experiences. So don't go in for directly, you can say, sending those messages. The first thing the law says also is you have to seek a permission before sending. लोग क्या करते हैं, ईमेल मार्केटिंग के थ्रू लोग करते हैं, ईमेल डाल दी 1000 लोगों को, अगले दिन गूगल ने जीमेल का अकाउंट ब्लॉक कर दिया. So what is the option? उसमें भी opt in करके चीजें यूज होती हैं. You have to opt for opt-ins and all those before going in for email marketing also. What script to use for patients to come back after 6 months for monthly checkups? Also, if a patient has undone treatment, how often we can remind them to come back for the treatment and what script to use so that it does not sound that we are being pushy. For the monthly checkup, always ask them, you will need to get a monthly check. You will need to get a 6 monthly checkup done. Do you want me to give you a reminder? If yes, you will get it on the message and on the call. The way your system is. आप message करते हो, call करते हो, set that and explain that to the patient. If the patient, नहीं, मैं reminder लगा रहा हूँ, I'll keep myself. Perfectly fine. That is the script to use for a recall. For a patient who is in the middle of a consultation, you can use the same script. They have gotten one treatment done from you, and the second they have postponed, ask them for a 6 monthly recall and use the same script. You want to give us a reminder? It also reminds them, my doctor reminded them of something else also, or something else to be done also. Have I got that done? If not, then it is better to ask for it prior. Don't be pushy in that regard. Just ask for the reminder. And if the patient has, you can say, just consulted you, usko aap पूछ सकते हो at that time, do you want us to give you a reminder? No, I'll decide and come back myself after consulting my family. In that case, you don't need to do anything. That is not your patient till now. That is just your consultation till now. So understand and learn the difference between the two things.